In this video, we are discussing about PYQs of Pediatrics from 2015 NeetPG paper. The first question is polyarthritis. Polyarthritis, the question is how many joints are involved in polyarthritis. The answer is more than 5. And the second question is congenital rubella syndrome. They are asking about the triad. The triad of congenital rubella syndrome are sensory neural hearing loss, ocular abnormalities such as cataract, congenital heart defects. The MCQs in the MCQs they give all the three, but they are asking about most common. Then we have to mark sensory neural hearing loss, which is most common than congenital heart defects, and then the least ocular abnormalities. The third MCQ is about gastric aspirate shake test. Gastric aspirate shake test is used in which disease? The answer is respiratory distress syndrome. Now we have to discuss about gastric aspirate shake test. Everyone will confuse with other options because in the name it says gastric. Everyone might have picked the option. They will give all GI related diseases. Everyone might have confused with GI related, may opt for GI related diseases, but no, the answer is respiratory distress syndrome. This test evaluates the presence of surfactant in gastric aspirate, which correlates with surfactant levels in lungs. In this test, the gastric fluid is aspirated from newborn and mixed with ethanol and saline. This mixture is then shaken and observed for stable foam formation. Absence of foam indicates the test is positive and there is respiratory distress syndrome, and presence of foam indicates negative, which means no respiratory distress syndrome. And the fourth MCQ is about composition of rhizomol. Rhizomol composition for SAM babies. Sodium is 45, potassium is 40, chlorine is 70, glucose is 125, magnesium is 3, zinc is 0.3, copper is 0.045. The fifth MCQ is about subacute sclerosing panencephalitis. It is a rare progressive fatal complication of measles, occurs in between 7 to 13 years after primary infection. Dicken's diagnostic criteria is used for subacute sclerosing panencephalitis. The regularly used tools are EEG, antibodies in CSF, antibodies in blood, increase in antibodies in serum. Rarely used are MRI. In MRI, we should detect white matter lesions. In CSF, we should detect oligoclonal bodies. Rarely used tools are brain biopsy due to its invasive nature. Diagnosis is mainly clinical, cognitive decline, behavioral changes, myoclonic jerks, motor dysfunction or seizures are seen in subacute sclerosing panencephalitis. The sixth MCQ is SpO2 for neonate after 5 minutes of birth according to neonate resuscitation program. Start at 60 at the rate 1 minute. Plus 5 every minute till 5 minutes. Only for the last 10 minutes plus 10. These targets acknowledge the Normal physiological transition from fetal to neonate circulation, where saturation gradually increases as the lungs expand and the pulmonary vascular resistance decreases. The seventh MCQ is severe bacterial infection in young infant according to IMNCI criteria. IMNCI guidelines indicate according to those guidelines, the danger signs are 50 breaths per minute or more, temperature less than 35.5 degrees Celsius suggests sepsis. The sign is increased number of skin pustules, 10 or more skin pustules. The eighth MCQ is child presented with abdominal pain, bloating after consuming milk product. The answer is lactose intolerance. Drug of choice for benign rolling epilepsy. Sodium valproate. 2-year-old showed normal development for 1 year, but now presents with developmental delay, hand wringing movements, and breath holding spells. The answer is Rett syndrome. 11th MCQ. 11th MCQ. Which of the following is not an endocrine change associated with PEM? Low cortisol. 12th MCQ. Sporo, which is the least common opportunistic fungus known to cause pulmonary infections in children? Sporothrix. STOS therapy is used for treatment of. Answer is vitamin D deficiency rickets. FSGS means focal segmental glomerulosclerosis. It is second most common cause of nephrotic syndrome after minimal change disease. It is typically steroid resistant, requires a renal biopsy for diagnosis, increased chances of relapse, progression to end stage renal disease compared to minimal change disease. Preferred site for bone marrow aspiration in infants, upper end of tibia.